Dear friends, today I am going to talk about hepatitis. Hepatitis can be of various types. It can be due to virus, due to alcohol, or it can be due to some other causes like autoimmune disease and some toxic hepatitis due to some drugs, toxins and all. But most important hepatitis in India is viral hepatitis and next alcoholic hepatitis. These two are the most common form of hepatitis. Coming to viral hepatitis first. As you all know, viral hepatitis can be of five types: hepatitis A, B, C, D, and E. D is fairly uncommon in India, and D occurs only on the top of hepatitis B. But hepatitis A and hepatitis E, these two are waterborne disease carried by water, food, foodstuff, fomite, utensils, and all. But hepatitis C and B, these two are bloodborne or it can be carried through body fluid, sexual load, etc. Now, hepatitis A and E, these hepatitis usually presents with some prodromal features in the form of anorexia, nausea, vomiting, fever, sometimes joint pain, etc. Patients become very ill at the outset. They all present in acute fashion. Patients become very ill at the outset and then gradually they recover their appetite, but the jaundice goes up. These are all self-limiting diseases. So after some days, automatically the jaundice comes down and the disease is controlled. So if we have to diagnose this type of hepatitis, we will have to do the serology for the viruses. That is IgM anti-HIV or IgM anti-HIV for hepatitis A and E respectively. Hepatitis A mostly occurs in young children, particularly kids. They don't uh, eat for some days, do not have good appetite, they don't have jaundice, but still they look very, very, very much malaise and all these things. So this is the presentation of hepatitis A. And hepatitis E is very notorious in pregnant women. They present with jaundice from the very beginning, and as the trimester goes, the hepatitis E becomes more and more severe. That means one pregnant lady who acquired the disease in the first trimester has better prognosis than one who is acquiring the disease in the third trimester. So in that way, hepatitis C is very dangerous in pregnancy, but otherwise hepatitis A is same as hepatitis. Hepatitis E is same as hepatitis A, and it clears on its own without any intervention. Only thing is we have to take care of the hydration part. I mean, the patient has to be given enough fluid, good food, and adequate rest. That is about this waterborne hepatitis. Coming to bloodborne parenteral route of hepatitis, that is hepatitis B and C. They are very common in India, particularly hepatitis B, and they are transmitted through blood, injection, sexual route, etc. They usually produce chronic hepatitis. Therefore, they are of particular concern because once this virus goes into the body, it stays even lifelong. And it is very difficult to treat hepatitis B because hepatitis B cannot be cured. What we can do is that we can only control the infection of hepatitis B, but we can cure hepatitis C with the very good drugs that have come up today. The drugs are very effective, but hepatitis B and C are important in the sense that once the disease infection goes unnoticed, they can give rise to cirrhosis of liver and its complication, means jaundice, bleeding, ascites or fluid in the abdomen, and sometimes cancer, liver cancer. So in that way, these are very dangerous. We have to remain cautious about them. And only hepatitis B has got good vaccine. So if we can vaccinate our children from the very beginning for hepatitis B, then they are saved from this dreaded disease. For hepatitis C, unfortunately, there is no vaccine. So we have to depend only upon uh, removing the route of transmission, like sexual route, like blood transfusion, injection drug abuse. We should not share the same needle for all. We should not use the same razor, same blade in the saloon. So these things are important for hepatitis C. Apart from this viral hepatitis, important thing, kind of hepatitis is alcoholic hepatitis. Alcoholic hepatitis is another very important problem in India, where heavy alcohol consumption for an extended period gave rise to this type of problem. Alcoholic hepatitis, the good part is that if the patient abstains from alcohol, then he can be cured of the disease. But if he continues to alcohol, then this disease can become fatal. In severe cases, we use corticosteroids and good nutrition. These are important therapy of alcoholic liver disease. Otherwise, abstaining from alcohol is the most important part. Quitting alcohol is the most important part in alcoholic liver disease. So these diseases are very important in Indian perspective. So we have to try not to take alcohol, or even if we have to take alcohol, then we have to take in moderate doses. We should not exceed. We should not do binge alcohol, like binge drinking, like taking more than 5 drinks over 2 hours. So these things are important, and we should have good nutrition, should have good medications, and if there be any problem, we should go to the doctor. That's all about hepatitis.